Medicare won't always cover air ambulance transportation, and misunderstanding the rules can cost you thousands. In this video, I'll break down what you need to know to make sure you're prepared when it matters most. Does Medicare cover the cost of an air ambulance? Medicare does cover costs for air ambulance services. There is Medicare A and Medicare B. These are government-funded programs that provide service and fees for insurance through the government. Medicare will have certain restrictions when it comes to international travel. So as an air ambulance company, most of our transport services do come from the Caribbean and abroad. And when international transport is included, Medicare will look at certain restrictions and not allow transport in that manner. When we are a domestic trip within the U.S. continental United States, Medicare will cover the transport based on medical necessity as well as providing the care to the nearest and closest location. Depending on the program that you are involved in, be it primary Medicare or Medicare Advantage plan, which is supplemental, there may be an out-of-pocket that needs to be met prior to Medicare taking care of the claim. What specific conditions for air ambulance are covered through Medicare? So Medicare will cover any instance for air ambulance services that requires emergency or non-emergency transport. Generally, when care is not providable via ground ambulance or there is a lack of specialty care and resources at the sending location, Medicare will cover transport to the nearest and closest facility that will allow for the treatment and services to be obtained. What's the process for obtaining Medicare coverage for your air ambulance? When a patient is seeking air ambulance services, insurance coverage is very important, and being able to identify if you are covered by your insurance, specifically Medicare, you're able to look at your benefits package that you may have received in the mail or via email from those Medicare programs. So prior authorization and pre-approval is not one of the services that occur for Medicare. Medicare insurance is provided to us as the provider through the patient or the case manager at a hospital. When we look at the Medicare coverage, we're generally focusing on an individual who is 65 years and older, an individual who is within the United States and needing transport to a specialty care service or a rehab service. And we also identify and help the patient understand that there are restrictions when it comes to Medicare that will not be covered, including international travel or trips abroad. What should I consider before booking an air ambulance on Medicare? So highly recommend a situation where if you are traveling abroad, to book the travel insurance that is offered to you. Travel insurance helps to support your need for air ambulance emergencies or non-emergencies that may arise in your trip, causing trip interruption. If you are a Medicare patient, it is important to note the facility you're working with or the provider you're working with be in network with Medicare, as well as understand the Medicare rules and regulations regarding abroad travel. It's important to note that the air ambulance will not be covered when a situation arises where ground ambulance is feasible to transport the patient from the sending facility to a facility in the area that is capable of treating or assisting the patient. So it is important to know that coverage is based on getting to the nearest and closest facility. So when we look at Medicare coverage, we identify that the patient has no access to ground transportation, being able to get them to a facility where they will get the treatment that they and the resources that they need, but also being able to get to the nearest and closest location that the treatment and services will be available. Different states have different coverage and policies, and so the claim that you file with Medicare may vary between those different states.